So, good day. I am Marigel G. Terescoro, BSN3 Block 3. I will going to demonstrate the step-by-step procedure of blood transfusion. So, the purpose of blood transfusion is to replace a blood loss of a patient who undergoes surgery or operations or has injuries. And also, the blood transfusion is done as part of a treatment for patient who has a certain illnesses. So the materials that we will going to use in this procedure are the blood product, the blood administration set filter number 10, and also the normal saline which has a 0.9%, and a venipuncture set with a gauge of venipuncture set that has a number of 18 to 19 gauge needle. So here, and we will going to use a catheter alcohol swab tape, and also the clean gloves. So for the first procedure, we will going to verify the doctor's order, the kind of type of product that we will going to administer to the patient, the amount of blood, and the date and the time, and also the rate, and also the duration of infusion. And after that, we will going to confirm the prescribed order for any pre or post transfusion to be transfusion medication to be administered to our patient, and we will going to check the patient's conditions. So how are you feeling right now, ma'am? Are you okay?
Okay.
Okay, so thank you so much, ma'am. And then we will going to check the patient's history of transfusion, if there is any reactions, if there is any reasons for present transfusion, and etc. So as you can see, the patient has a transfusion right now, which has a normal saline of 0.9% on her left arm. So after that, we will be having to identify the patients and also check the availability of the blood in the blood bank. So, ma'am, may I have your complete name and your birth date?
Mariam Larry Ruiz is my name, and I am born in December 17, 1999.
Okay, thank you so much, ma'am. And then we will going to explain the procedure to the client for the transfusion, what kind of blood product that he will be given, and also that we will be given, and also the approximate length of time and the desired outcome, and also we will going to emphasize the need for patient to report any discomfort or any unusual symptoms immediately. So, ma'am, you will be having a blood transfusion because you lost a blood, so it will help you to replace your blood on you. And this procedure might be length of 4 hours, and I hope that I encourage you to um, to inform me if you feel any discomfort, you feel pain, or you feel that you are swelling. You are free to say it to me immediately, so that we can say it to your physician, so you will be having a abrupt procedure to be given to you. Is that okay with you, ma'am?
Alright.
Okay, thank you so much for your cooperation. And then after that, we will now going to check the prescriber obtains the necessary consent. So it is very important that the patient has a consent that he are allowing us to have a blood transfusion to her. And then after that, we will, as the nurse, we will going to confirm the consent by ensuring the patient that he understand that she understand the procedure, the patient also the rationale, and providing an opportunity for the patient to ask questions, or you will answer the questions or concerns that the patient asked for you, and you will go to document the confirmation on the consent. So Ma'am, do not hesitate to ask questions. Do you already understand the procedure that we will be given to you?
Yes.
Okay, so thank you so much, ma'am. And then after that, we will going to obtain the blood from the blood bank in accordance with the agency policy. And we will going to encourage the patient to empty the bowel and the bladder and assist her in a comfortable position. So, ma'am, you are free to have a bowel. You can use a comfort room here. Do you want to pee, ma'am, before I will going to administer you a blood transfusion? Okay, so
Thank you.
are you comfortable right now, ma'am?
Yes, I feel good.
I will going to position you in a comfortable position. Is that okay with you, ma'am?
Okay.
So after giving a comfortable position, encourage the client to empty her bladder, we will now going to check the cross-match record with another licensed nurse before administration. We will going to check for the A, B, O group and the RH types, and also the client's name, and also the IB blood band, and also the hospital number, and also the expiration of the blood, and also the date of it. So I will going to ask for my assistant, my license. So ma'am, we will going to administer a blood for the patient's name, Miss Mariam Lyrene Dumis. Ma'am, have you checked it?
Yes.
Mariam Lyrene Dumis. And the blood type is AB+.
Yes.
The hospital number is 001
1.
0123.
Yes.
Okay. So, ma'am, can you check the client's band on her left arm for the confirmation? Mariam Lyrene Dumis, right, ma'am?
Yes.
Okay. So, thank you so much, ma'am. And then after checking for the cross match of the blood with my colleague, so I will going to warm the blood at room temperature before transfusion. So I will going to ensure the privacy of the patient, and also I will going to check the vital signs and document it on the record. So by giving a privacy, ensuring the privacy of our client, we will going to close the door and the window and draw the curtain. So, ma'am, I will going to take your vital signs to have a baseline on you. I will going to put the cuff on your right arm.
$331 million.
I'm now going to take your blood pressure, ma'am. Your blood pressure, ma'am, is normal, which is a range of 100/80. Thank you. Now going to remove the cuff. Okay. Thank you, ma'am. taking the blood pressure, I will now going to record it on the record sheet. Vital signs. 100. So after checking the vital signs, I will now going to wash my hands and dry my hands also. So after washing my hands and dry it, I will, if the patient has IV solution, we will going to check whether the needle is and the solution are appropriate to administer the blood. So upon checking the IV set, the IV solution set is 0.9% of PNS, which is very good for it is good for a blood transfusion. The needle of the patient is 18, where it is appropriate for a blood transfusion. So after that, I will going to identify the accessible veins and select a large vein which allows the patient mobility, and also we will going to open the sterile packing of the blood transfusion set and aseptically insert the infusion set into the bag blood of the transfused. So before that, I will going first to wear my gloves, clean gloves. So we will now going to open the sterile package of the blood bag. So after that, so I already attached the set of the blood. So we will going to start the infusion slowly. So we will going to transfuse the blood. So I'm going to attach it here. We will going to administer the blood. So we will going to first clean the white, where the part of the blood we can fuse to avoid transfer the microorganism, to avoid infections. So I will first going to close the clamp on the IV set solution of 0.9% of PNS before attach the so I will now going to insert the needle. So first, after we will now going to adjust the roller clamp for about 15 minutes and adjust it for first 15 minutes and adjust for 30 minutes drops per minute, and remain at the bedside of the patient. And then you will going to remain at the bedside of the patient for about 15 to 30 minutes. If any reaction is suspected, notify the blood bank and also the physicians of our client. And then after that, we will now going to monitor the vital signs every 5 minutes for the first 15 minutes and every hour thereafter. And we will going to observe for any flashing on the IV, and also if there is any swelling. There is no swelling. If there is any swelling or itching or rash, and we remember that do not mix any medication in any blood transfusion. So after assuming that the administration is already at 4 hours, so we will going to stop the transfusion immediate. Rather, we will going to stop the transfusion immediately if any reaction is suspected and do not incorporate the medication. So if there is, you see that the patient is has a rash or itching, you will going or suspected any complications, you will going to ask report it to the blood bank and also to the physicians of our patient. And we will now going to administer the 0.9 NaCl before and after the blood transfusion. So as you can see, we will going to administer the 0.9%. So before, she already administered the 0.9% of normal saline, and after, we will going also to administer it again. So after that, administer the blood for 4 hours only. So as you can see, we will already transfuse the blood on the patient for almost 4 hours. So assuming that the blood transfusion is done for 4 hours, so we will now going to after the blood transfusion, remove and dispose the gloves properly and wash your hands. So we will going to lock the roller clamp for the blood transfusion first, and we will going to remove the connections and clean. And we're going to close. And we will going to dispose it properly according to the agency protocol. And also, we will now going to start infusing the IV solution, which is a 0.9% of normal saline PNS to the patient. So after that, you will going to remove and dispose the gloves properly. And then after that, we will going to record the administrations of the blood, the date and the time, the kind of blood groups it is, any adverse reactions for the patient, and the amount of blood that are infused during the blood transfusion, and also everything that are transpired. So we are going to record it. So after recording, we will going to observe for any flashing or itching or rash, and patient instruct the patient to call your attention if he or she feels something unusual. So we will going to observe for the flushing if there is any itching and swelling or rash. So ma'am, Ma'am Lyrene, if you have feel unusual on your bloods in your site, you are free to call me or your physicians immediately so that we can help you with that situation. So thank you so much, ma'am, for your cooperation. So we are done for our blood transfusion. So that's all. Thank you.